Well, good afternoon, everyone. My name is Joshua Dubois, and I'm Executive Director of the White House Office of Faith-Based and Neighborhood Partnerships. And I want to thank you all for joining us this afternoon for this momentous call to action. As so many of you know, and as so many of you are working on, HIV is a serious challenge facing our communities and indeed our entire nation. And that's why we're pleased to host this call to action today, to engage faith and community leaders who've been on the forefront of working to turn around this crisis all around the nation. We're excited to learn about your experiences and participate together in this call to action. Just so we have some baseline facts first, an estimated 1.1 million people are living with HIV in our country, but 1 in 5 do not know that they are infected, and more than half of American adults ages 18 to 64 have never even been tested. Worldwide, about 52% of people living with HIV and AIDS are women. Now, faith-based and community-based organizations play a significant role in reducing health disparities and working to solve some of the most complex challenges we're facing as Americans, including HIV/AIDS. As trusted leaders who know their communities well, you, faith and community leaders, can help folks learn the facts about HIV and also proceed on prevention and testing strategies. Now, through the first ever national HIV/AIDS strategy, President Obama has charged the Federal Centers for Faith-Based and Neighborhood Partnerships with actively engaging faith communities to help end stigma around HIV/AIDS in order to make sure that we're effectively preventing the disease, reducing new infections, and getting people connected to early treatment. Early treatment is key. As a director of President Obama's administration in President Obama's administration on faith-based neighborhood partnerships, I'm pleased to host this conversation today and to launch a national call to action on these critical issues. With this call to action, we want to affirm all of the great work that faith and community-based organizations are doing already to respond to HIV/AIDS. But we also want to invite increased participation and awareness so that we can make further progress on these challenges. Some of us remember a time when even cancer was called an unspeakable disease. But now we are better educated than ever in responding to cancer in a myriad of ways. Now the time has come to take that same approach to HIV/AIDS and make sure everyone in our community is aware of their status, tested, and fighting this disease aggressively. Now, when the President announced the HIV/AIDS strategy almost a year ago, he told us that HIV reminded us of our obligations to one another, obligations that, like the virus itself, transcend barriers of race or station or sexual orientation or faith or nationality. No truer words have ever been spoken, and that's why we're motivated by that call to action to reach out to you, faith and community leaders around the country. It's a great pleasure to share this moment with my wonderful panel today. Let me introduce them and give them an opportunity to discuss their backgrounds with this work before we get started. First, we have Chantel Britton. Chantel's a scientific advisor for the Office of National AIDS Policy here at the White House. Next is Reverend Edwin Sanders. Reverend Sanders is the senior servant and founder of Metropolitan Interdenominational Church in my hometown of Nashville, Tennessee, and former member of the President's Advisory Council for HIV/AIDS.
Thank you, Joshua.
Thank you. Now we have Pernessa Seal. Pernessa is the CEO and founder of the Balm of Gilead Incorporated.
Thank you.
And finally, Philip Thomason, or Phil, the Minister of Outreach and Pastoral Care at St. Mark United Methodist Church in Atlanta, Georgia. Phil, thanks for joining us.
Thank you.
Before we go too much further, Chantel, why don't you start off by telling us a little bit about HIV/AIDS in America today and President Obama's plan to end stigma in the National HIV/AIDS strategy more broadly?
Sure. I'll go ahead and make my comments really brief because I know we want to cover a lot during this important discussion. First, I want to say thank you to the U.S. Department of Health and Human Services and to the White House Office of Faith-Based and Neighborhood Partnerships for convening this important meeting. And to also let you know that my boss, Jeff Crawley, here at the Office of National AIDS Policy, sends his greetings. I currently serve as the policy advisor within the Office of National AIDS Policy, and I lead the team's work on women and girls issues and access to care issues that impact women and girls. I'd like to first start off with a few quick facts about HIV in America. So as Joshua stated, there are 1.1 million people living with HIV in the United States, and 56,000 people are infected every year, and every 9.5 minutes, someone is infected with HIV. The Centers for Disease Control and Prevention estimates that 21% of those infected don't even know their status. The populations at greatest risk for HIV include gay and bisexual men, who just represent 2% of the population in the United States, but 53% of all new infections. And that also includes young Black and Latino gay bisexual men who have higher HIV incidence among that population. Black Americans represent 13% of the US population, but 46% of all new infections. Latino Americans represent 15% of the US population, but 17% of new infections. And we also found in our work with developing the National HIV/AIDS Strategy that substance users, it's estimated that there are about 1 million injection drug users, and they account for 16% of new infections in the United States. It should be noted that the rate of HIV infection among Black Americans is 7 times that of white men and women. And while women represent 26% of all infected with HIV in the United States, Black women are 19 times more likely to become infected with HIV than white women, and Latinas are 5 times more likely to be infected. In terms of lifetime risk of HIV infection, 1 in 16 Black men and 1 in 30 Black women will become infected in their lifetime, compared to 1 in 35 Latino men, 1 in 114 Latinas, 1 in 104 white men, and 1 in 588 white females. And in the United States, the biggest investments in HIV have been associated with ensuring that people affected adequately receive appropriate care and treatment. Mandatory programs like the Medicare program and the Medicaid program, and discretionary programs like the Ryan White program, are some of the biggest programs in the United States that are available to help people gain access to care. Other investments in the United States associated with HIV include prevention and research, income support like the Supplemental Security Income Program, SSI, housing, and others. So research is certainly paying off. Currently, there are more antiretroviral therapies to treat HIV than those that exist to treat all cancers. And next month, we will commemorate the 30th year of AIDS in America. This marks the 30th year when the first AIDS case was reported by the Centers for Disease Control and Prevention, the CDC. As a nation, we've come a long way since then, but we still need to do a lot more to end this epidemic. That's why last year, as Joshua mentioned, President Obama released the National HIV/AIDS Strategy, the first comprehensive plan for responding to the domestic epidemic. The strategy demonstrates the president's deep commitment to fighting the HIV epidemic here at home. The strategy has 3 top action steps: reducing new infections, which includes intensifying HIV prevention efforts in communities at highest risk, so gay and bisexual men, Black Americans, Latino Americans, and substance users. Another top goal of the strategy is to increase access to care and improve health outcomes for people with HIV. So establishing a system that will link people to continuous and coordinated quality care when they're diagnosed with the virus. And reducing HIV-related disparities, which includes reducing stigma and discrimination against people with HIV. For more information about the strategy, I encourage you to visit www.aids.gov. So now I'd like to highlight that implementing the strategy doesn't just fall on the federal government alone. We all have a role to play. The faith community has a significant role to play. As leaders within the faith community, congregations are uniquely positioned to help implement the strategy by engaging in activities that support the 4 key goals: reducing new infections through prevention, increasing access to care, and helping people get the care that they need, and reducing health disparities, particularly by reducing stigma and discrimination. Our partners in the faith community can also help in more specific ways by encouraging healthy relationships, increasing awareness and education around prevention, encouraging affected communities to get treatment and assisting them in finding the right care. So now I'll turn it back to Joshua.
Well, thank you so much, Chantel, for that wonderful information, just a baseline of data and information that we can use to draw from throughout the rest of our conversation. With that, let's get the conversation started. You know, Pernessa, there's no one who's worked more closely with churches around the country on HIV/AIDS prevention and response strategies over the course of their career than you. I'd love to know sort of what some of the practical things that local congregations are doing to respond to HIV/AIDS, how they are setting up testing days and other things like that. Would you mind sharing a little bit of that with us?
Sure. Well, you know, as I sit and think about, we've come a long way over these past 30 years with the faith community. We can probably write a book just on the history, the progression of faith communities and HIV in this country. And churches and as well as other faith traditions are now today are doing, they have HIV ministries, they have HIV testing programs daily. They have clinics like Reverend Edwin Sanders Church have a whole clinic. They're doing an array of things. They have case management programs. Churches are doing a lot of different things, but yet there are so many churches who are still haven't put their feet to the fire yet. We have all the time where churches are asking, well, how can I get started? How can I do my get started with HIV testing? And the answer is, first, you know, make sure that your congregation and your pastor is educated. You know, we don't want your congregation to start at the point of HIV testing. What's important that your congregation start is at the point of let's get the facts, let's get information, and let's make sure we have a compassionate response to those who are suffering. Once we have done the basics, which is compassionate ministry and education, then we are ready to partner with outside agencies, partner with your health department, partner with AIDS service organizations, those organizations that have the expertise that can come to your church and provide the HIV tests, you know, give you the facts around HIV testing, give you the facts on, you know, the positivity, the negative, and most important, if there are people in your congregation who are positive, referrals on how they can then get in treatment, and those who are negative, referrals on how they can stay negative. I also want to say, Joshua, that the church has such a serious role to play in people getting tested, because the church is the place where we set community norms. We change the norms, we set the norms. And you know, the Balm in Gilead for the past 10 years have been running Our Faith. It was first Our Church Lights the Way, and now it's Our Faith Lights the Way on HIV testing, where we have, I would say, about 10,000 churches who are doing HIV testing doing June now. So it's a movement that we have to constantly push and push, because the role of the church in getting people tested is so very, very critical. When the pastor begins to get tested and congregations begin to get tested, the community begins to get tested.
Well, thank you so much. And Pernessa, if folks want to know more about what the Balm in Gilead is doing in June, what's your website or what's it with?
www.balmingilead.org, and you can call our toll-free number 888-225-6243.
Wonderful. You know, I was actually at an event in Baltimore this week, and the pastor held a testing day on Sunday, so not Saturday, but right in the middle of service on Sunday, and she and her husband were tested right in front of the congregation. So some tremendous work there. Reverend Sanders, Pernessa talked a lot about awareness and just getting that education out there. And now these are some tough subjects for some congregations to unpack. What's your sense of how congregations can deal with awareness and education within the context of a local house of worship? And I'd also love for you to share a little bit about what you're working on in Nashville as well.
I think Vanessa's 100% right in terms of this whole business of education. But I think that one of the things we have to do is ultimately help clergy and faith leaders to frame the issue in a way that allows it to still be born out of the traditions from which people speak in terms of their faith. Also, it's important to move it to center stage, to where we're not just talking about something that's peripheral to what's going on in the life of the church, but rather that it's central. I tell people all the time, you can tell where the priorities of the church are in terms of mission and in terms of outreach in terms of what gets addressed from the pulpit. We have a lot of other opportunities to engage people in the community, but by and far, what happens at 11 o'clock on Sunday morning is most important. So we spend time helping people to learn how to frame the conversation such that it could become a Sunday morning conversation. For me, that ends up being first and foremost talking about life. In too many instances, a part of the stigma that's associated with the disease is because for too long we looked at it in terms of being a death sentence. The fact is, where we are now, this is a disease that you can live with. The antiretroviral drugs that we have allow people to be able to live lives that are fulfilling and as rewarding as anybody else. I think that what we see in terms of the research, there's significant strides that have been made in terms of what I think will eventually translate into a vaccine. But one of the things that we work on very hard is making sure that people understand the full array of strategies that have to be responded to and how we fit into those strategies. One of the things I spend a lot of time doing now is helping to mobilize faith communities where they are more open to being involved in vaccine trials. Because indeed, right now, there's a disparity in terms of involvement amongst people of color and the people being most disproportionately impacted. So one of the things that we would hate to see happen is that we end up with a vaccine that does not have the same level of efficacy with one group of people over against another. So we spend a lot of time trying to move faith leaders in that direction. It's also important to get people to understand that it's not just a one-dimensional way in which you can respond. Testing is important, raising consciousness is important, information dissemination is important, but also there are things that already exist within the church that make it a very important and viable part of our response to HIV/AIDS. We have vans that end up being very easily used to provide transportation. We have care teams that in many instances have already been developed in response, especially to grief and sickness, but can be easily shaped in ways that help them to be responsive to the ways in which we address the whole issue of HIV and AIDS. So we spend a lot of time making sure that people have the full array. The other thing that I found to be very important is to help people to learn how to speak about this disease in a way that gets them beyond the limitations that are sometimes the byproduct of not having a broad enough perspective in terms of what drives this disease. The whole business of social determinants ends up being very important because much of what has caused some communities to be more disproportionately impacted than others is a byproduct of historical realities and social realities that when they're put in proper context, it doesn't end up being the issue that bears the burden of being defined as a scourge and ends up being defined in ways that are always associated with sin, ethics, and morality, but rather realizing that there are many other dynamics at work in our society that are driving this. The Center for Disease Control a few years ago very clearly established that one of the things that perhaps drives infectious disease disproportionate impact in communities has a lot to do with the whole business of social stratification, much more than it has to do with behaviors of promiscuity or behaviors that are outside of what's acceptable norms. Yeah. So that level of education is important. We started doing this work 26 years ago, but the reason we started 26 years ago is because the first member with 30-year-old congregation, our congregation began on February the 1st, 1981. HIV/AIDS was identified as we know it now on June the 5th, 1981. Wow. So in that same year, we have a relationship in that level, but the first person to die in the history of our congregation died from HIV/AIDS. We didn't know it at first, but the minute we discovered it, we began to do education. And then when we began to do education, we realized it was important to do work around prevention. And then after prevention, we realized there were people that needed direct services. About that time, around 1991, this young lady right here, Vanessa Seal, used the leverage of the name of the White House to get a lot of us to come here to a meeting called
in this building.
In this building, as we were talking, we talked about the declaration of war against HIV and AIDS. At the end of that meeting, Vanessa kind of hit all of us unexpectedly and threw a card in front of us and said, "Put down what you're going to do. What's your commitment when you leave?" Caught off guard and thinking very naively, I decided that I would write on my card that for the next 52 weeks, every worship service at Metropolitan Church would say something about HIV. We did that for the year. It was challenging. There were people who raised a lot of questions about why we kept pushing and pushing and pushing, but it was a transformative moment in terms of our congregation and also began, I think, to influence the way in which other people in our community saw us as not just being some extreme group, our church, in terms of addressing these issues. But we've seen a tremendous change. We used to be the HIV church in the community. Now there are many. And as a result of the work that we've been able to do through funding from the Centers for Disease Control, that's allowed us to be able to do capacity building across the country. We've actually worked in 32 states. We right now are involved in initiatives in major centers. But what we're trying to do is bring together, as I was saying a minute ago, the resources, so that the things that HRSA is doing, the things that SAMHSA is doing, the things that CDC are doing, the things that the Minority Initiative is doing, that all of those come together so that our communities are comprehensively responding over against being one-dimensional and also over against being locked into a narrow perspective that suggests that this disease is being driven by something that's immoral and outside of the church.
Well, it sounds like you're really affirming the dignity of individuals with HIV and AIDS and saying that they have just as much worth and value as anybody else. So just appreciate the tremendous work and really groundbreaking work that you all are doing together, and really much of it started in this very building. Phil, I want to go to you now. You know, a lot of the conversation about HIV/AIDS today is about young people, and we're glad that more and more young people are getting tested, although more needs to happen. But that often leaves out folks who are a little bit older, some of our senior citizens or folks who are middle-aged. What do you think about the ways that we can engage older communities on HIV/AIDS, on testing, and on stigma issues as well?
Well, I think one of the things that we have to do is to work as hard as we can to remove that stigma. I agree totally with what you said, that it has to be from the pulpits of the church. There is still the stigma attached to it all that it is a young gay man's disease. And we have to somehow figure out how to get people to understand the statistics that you gave and to realize that it is not just a disease that affects young gay men. You know, I didn't start out doing this. I started out as a pastor of a little church in South Georgia and somehow ended up in a church in Atlanta that has stood on the edge for caring and loving people for 110 years. And it wasn't until the early 90s when we were doing all that we could to keep up with what was going on. We were burying 15 to 20 young men a month. And it was one of the most mind-boggling experiences that I've ever had in my life, to help what parents would come to the funerals of their own children understand what was going on, but then to see your ministry go beyond that into the homes and the lives of these people to help them remove the stigma that was attached to their child. And it has been a job, it is still a job. I work real closely with Grady Hospital in Atlanta. Grady is a large metropolitan, quote, charity hospital that is filled with folks that need someone to care for them. And I think that as St. Mark has cared for the homeless and the poor and the disenfranchised over the year, we were called in the early 90s to do the part that we could as a church to help people become more aware of what was going on. One of the things that we are trying our best to do is to take the message of HIV and AIDS into the Senior Citizen Center, the nursing centers in Atlanta, so that we can help those people become more comfortable with being tested, which I think in itself is a job. But another concern that I have is the young people that I know that are being tested and they're coming back positive. They are not taking that positive test as something that I see as very, very important. They're taking it as something rather flippant. There's a medicine, there's a potion, there's a cream, there's something that will help me live beyond this. And I think I can speak from that from a personal viewpoint. About 8 years ago, my son, who is a young gay man, called me from the parking lot of my church and said, "I need to talk to you." So I met him outside. He immediately told me that he had tested positive. And we went to the doctor together that very day. And I can remember sitting in the doctor's office when my son was looking at it rather flippantly. And I can remember Dr. Richard Kaufman, who is wonderful MD in our church looking at my son Jason and saying, son, this is not anything that you take lightly. And if you're going to take it lightly, then maybe I don't need to be the physician that takes care of you. So it comes from the pulpit. It comes from your community. It comes from knowing what you've been called to do and what you have asked your people to do through that calling of yours.
Absolutely. I think it's an important balance between ensuring that there is a tremendous amount of hope, a wellspring of, of future for individuals who are living with HIV, but at the same time understanding that an element of responsibility is important as well. And it sounds like you're working to strike that balance. One of the things I'd love to talk about, we talk a lot about prevention, but what are some strategies that faith communities can pursue to actually support individuals living with HIV/AIDS? Are there some things that you all have seen? We do talk a lot about prevention and testing, but what about the affirmation and support for individuals living with HIV?
Well, I think one of the things that I've seen in Atlanta is the fact that AIDS service organizations are disappearing as quickly as anything that I've seen disappear. The money has dried up. There's no funding available for it, and people are beginning to see that this disease is something that is totally absent from our society at the moment. They just look over it, they don't see it as important, and we're working very, very strongly in the city to bring back agencies like our Alliance for Faith and Health in Atlanta. We're working to bring back organizations that can help people become more involved in the community and in the disease.
It's amazing how there are a lot of things that we overlook because they are very basic and very simple that can mean a lot. One of the groups that we do at our church is called Men of Faith, Men of Color. And more than anything, it's a place where people can come on one afternoon a week where they sit and watch television, they play cards, we always feed them. And it ends up being a safe place, a place that is always welcoming and a place that's affirming and that they can feel comfortable coming to. At the same time, though, we also have a primary care clinic. I'm not sure that there is another congregation like ours that has a primary care clinic that specializes in HIV. But I'm very thankful to HRSA that a number of years ago when they decided to fund some pilot projects, we were one of them, and eventually evolved into being a fully operating clinic.
Can I ask you a question about that? And
Sure.
Chantel, I'd love for you to jump in as well. For organizations, and this gets to your comment, Phil, that for organizations that that want to engage the federal government in a partnership around something either as formal as a primary care clinic like you have in your partnership with HRSA, or in other ways, education, stigma, how would you suggest that they get started? How would you suggest that they begin that partnership? Chantel, I'd love for you to speak to this, and Pranessa, I know something you deal with as well.
Well, one of the things is the business of partnership and collaboration. If I was starting at this point right now, I think that I'd be looking more and more in terms of how you bring the resources, the energies, the passion, and the commitment of various folks who are concerned in the community together. It's hard to be one-dimensional anymore. Now, over time, we've been able to develop many different dimensions of our work under one umbrella. We do work that is driven by the whole business of substance abuse, so SAMHSA funds that for us. The clinic itself, HRSA funds that for us. CDC allows us to do technical assistance and that kind of thing. But I would suggest that if you were starting right now, that one of the things you'd want to do is work with an agency that already has developed a track record and has a relationship and knows how to navigate and negotiate the business of federal dollars. It's not easy. It is very demanding. I think we find ourselves, even after being a part of that dynamic for many years, we're still a challenge because having the infrastructure that allows you to be able to run those kinds of grants and funds is very hard. But I would say that the most important thing is to have people to start where they are, because in many instances there are things that people are already doing that they can then, for instance, HUD is one of the
Housing and Urban Development.
Housing and Urban Development is one of the agencies, again, that has housing programs that allow you to be able to develop the kinds of housing that can be very important to people who are living with this disease. So there's many ways in which you can do the support. Yes, Vanessa.
And I want to, in addition to that, I want to speak to the faith communities who are in rural communities, where there may not be other organizations to partner with. And in those places, you know, we have the internet now. There are a lot of resources on the internet on how to write a grant. And sometimes the first grant is not necessarily the government grant. The first grant may be the United Methodist Church grant, you know, or those small grants that are local. Because oftentimes, you know, churches come to the BOM and they want to know, I want a grant from the government. Well, have you ever written a grant? Do you know anything about a grant? No. So you may want to start at the local place, and then if you're a little bit more sophisticated and have done more of those kinds of grants, and I definitely, you know, ditto what Reverend Sanders have said in terms of partnering with other agencies. When we started a long time ago, we were solo, but now it's definitely about community partnerships.
Great. Chantel, anything to add?
Certainly, I would echo all of that. I would say that for any organization out there, if it's a faith organization, look at the successful models. And Reverend Sanders certainly has a successful model out there. And just think about, you know, how do you start small, like Pernessa was talking about, and also just making sure that, you know, that you're targeting the right population. You know, the funds are very scarce in this area, and we want to make sure that we're targeting the funds to the appropriate communities. And like I mentioned before, in the strategy, if you want to follow the strategy, it's those 4 key populations that we're focusing on. But I will say something about testing.
Please.
I want to make sure that people get this. And the Centers for Disease Control and Prevention is an excellent resource, so I encourage you to go to their website, www.cdc.gov, for more information about testing, and visit hivtest.org to find out where you can receive a test, a confidential HIV/AIDS test. You can also text your zip code to KNOWIT, KNOWIT, or 56648. So I just wanted to put that out there.
And let's give that again. So it's hivtest.org?
It's hivtest.org, or you can text your zip code to KNOWIT, KNOWIT, or 56648.
Question for all of you, you know, and not to get on one side or the other of any theological issues, but say there are religious leaders tuning in today or that will watch the webcast in the future that want to do what you did and preach sermons on, and what you do all the time on HIV/AIDS. Are there sermon guides? Are there resources? Are there books written about that topic?
Definitely. Vanessa.
Well, the Balm and Gilead has a book of sermons that's available. And again, you can call us at 888-225-6243 to get that book of sermons. And in that book, you have sermons by Reverend Sanders and T.D. Jakes and Calvin Butts and who else? Beecher Hicks. And it's about 40 or 50 great sermons on HIV that has been delivered.
Of course, you can't preach them anymore when you go other places.
But they're guides. They're guides. We also have a resource on how to develop a sermon by Dr. James Forbes. So that is a publication that we have that we would readily send. I think it's on our website as well. You can go to www.balmandgilead.org and pull down how to develop sermons by Dr. James Forbes.
Absolutely. I should say that the LGBT religious community has stood up in a tremendous way to speak out and to advance some of these issues. My good friend Bishop Yvette Flunder and Harry Knox, formerly of the Human Rights Campaign, and others. So, Yvette Flunder's in the sermon guide.
Bishop,
so
we couldn't have a book without Bishop Yvette Flunder in the book.
That's right. So I just want to give a healthy nod to that tremendous work as well. You know, you all have been working on these issues for a long time. You became interested very early on and have a compelling personal story with your son, and you all were there in the earliest days. Reflect a little bit, if you don't mind, on where we've been over the last number of years and where we are now in terms of the history of this crisis, of this disease, and where we're going at this point. If you wouldn't mind just giving us a little bit of perspective there.
One of the lines that I like to use when we talk about testing is to always say everybody has a status. And the issue is, do you know yours? One of the things I think is very important for us is to learn how to respond to people who test negative as well as those who test positive.
Interesting.
Because sometimes the people who tested negative, they don't get any response. As a matter of fact, for some, it translates into, oh, it's a license to go out and continue to live my life the way I've been living it, over against it being a very important point of engagement that allows you to be able to perhaps inform people in a way that they will never become positive. So I think that it's important to talk about testing in terms of a way that becomes very much routine. A few years ago, the CDC initiated an initiative called Opt Out, which was intended to make sure the providers were going to at least recommend or offer the test to everyone they saw. It gets to be important. Until testing becomes routine, until it becomes very much something that's normalized, the way we do other tests all the time, I think that we'll continue to see the problem not be addressed as forthrightly as it can. So I think that is interesting. But over time, what I've seen is open-mindedness.
More open-mindedness?
More open-mindedness. I think that people who would not talk about HIV at all, at least now have it on their radar screen. It's very interesting. You talked a minute ago, you made reference to the LGBTQ community. I always like to say the Q, because it's important to talk about sexuality, not just around the issue of HIV and AIDS, but it's a dimension of human life. I mean, we like to talk about it as a gift of God. We have a great researcher in Nashville, Dr. James Hildreth, who always says that there's three things that you always know that human beings are going to do. He says they're going to eat food, they're going to drink water, and they're going to have sex. Well, we spend a lot of time talking about diet. We spend a lot of time making sure that there's access and quality water to people all over the world. But I think the way you talk about it in the context of the church is to make it a part of something that's bigger than a problem, but to rather talk about it in terms of part of a natural human thing. And then I always, if you notice, I always throw the Q at the end. I first did not take that seriously when people started saying LGBTQ. If you say LGBT, you're talking about less than 10% of our society. If you add Q, you're talking about close to 50% of the society. Because all of us in our discovery of self have questions about who we are as sexual beings. And I think it gets to be important that it's a conversation that occurs when you're not talking about disease, when you're not talking about that which is threatening to life, but rather when you're talking about that which is affirming and celebrating of every dimension of life. Right. And I think the church is the best place for that. Because too often, in instances, the messages don't come from the right place. And we have to be the institution and the vehicle that the right message gets out instead of the wrong message.
You know, I think that's exactly right. One of the things that's been fascinating to me is the growing extent of collaborations across the ideological spectrum. You know, I've talked to very conservative pastors who understand that this is an issue that we have to take on, and certainly folks in more progressive communities as well. One question for you all: you know, our churches, synagogues, temples, and mosques are places for adults, but they're also places for children and for young people. Sunday schools and vacation Bible schools and the Sabbath schools and so forth. Are there children's curriculums to sort of unpack some of these issues in a way that's sensitive and age appropriate?
Once again, the Sunday school curriculum that has been developed by the BOM and written by United Methodist minister Dr. Cochran out of New York. And we assembled a dynamic group of theologians and scientists like Bob Fuller Love and Christian educators a couple of years ago. And just next week, we're going to finalize that document, and it will be, it's for young adults, young children, young adults, family, intergenerational, and it is a whole 52 Sundays of HIV Sunday school curriculum.
That's outstanding. You know, I just say as a technical matter, because we're the White House and the federal government, we don't endorse any particular curriculum, but what we do want to make sure is that folks tuning in are aware of all the tremendous and rich resources provided by the organizations on our panel and others around the country. We're nearing our end here, but I want to just offer some opportunity for some closing thoughts or statements from everyone on the panel, and maybe we'll start over here.
Well, you know, one of the things that I would like for people to hear is there are all kinds of resources out there, but I think the biggest resource we have are the people that are in our churches, the people that can teach their children to love one another regardless of a status, a color of skin, a sexual orientation. It comes from that pulpit. It comes from the people of that church who have used their life journey to teach their children to do what's right. You know, St. Mark is a church that is 94% GLBTQ, probably more GLBT that I know of right now. We stand from that pulpit each and every day and teach those children. When I came there was one child. Now we've got 30, 40 children running through the building. It's our responsibility as pastors to see that those children are taught correctly, and whatever that means, it's our job to do it.
Thank you so much, Phil. Vanessa?
I want to close by just sharing a question before in terms of what are some of the historical moments.
Yeah.
And I believe the Week of Prayer in 1989 when we launched the Harlem Week of Prayer that became the Black Church Week of Prayer that is now the National Week of Prayer for the healing of AIDS. And there was, you know, a group of pastors and imams and Jewish leaders in Harlem that took a risk. Mm-hmm. And I remember the great Y.T. Walker said in '89 that he'd already buried 40 men from his church. And then became a group of leaders in the country who took a risk and said, you know, I'm going to stand in my pulpit and give prayer. And then 2 years ago to get a statement from the President of the United States for the National Week of Prayer. I think that that's definitely historical markers. And that Week of Prayer opened a lot of doors. It allowed the pulpit to become that place where the word went forth. And people came and said, Pastor, I have HIV. And I think that was a marker in terms of a national movement of faith communities doing this work. March is the National Week of Prayer. It is now for everybody. We invite everybody, America, to come together and pray, because I believe that the faith community will lead this country to the end of this epidemic.
Thank you so much,
I have to
Vanessa.
tell you, Vanessa is, I always call her the little prophet, because when people talk about what you can do, it gets to be really important to appreciate the fact that when Vanessa started the Week of Prayer for the Healing of AIDS, she was one person who finally got one preacher to march around one hospital with us. Amen. And now there are 10,000 churches that do it. So that's the other thing, is don't underestimate what one person can do.
Absolutely.
The other thing that I would say as a closing remark on my general comments is that I've discovered that the language that we use in the faith community in response to this disease is very important. We've used the language here, but I think it's important to emphasize. I spend a lot of time talking about life, about liberation, and about love. Even when I talk about sexual orientation, I much prefer to talk about same-gender loving people. When you talk about love, it brings it into the arena of what has to be dealt with forthrightly across the spectrum. And I appreciate what you were saying about there's so many people who, especially theologically, philosophically, in terms of precept and concept, come to this disease from different places. But yet there are some things that cut through all the threads, even in terms of faith. I mean, you can talk about life, liberation, and love with Muslims. You can talk about life, liberation, and love with Jews. You can talk about life, liberation, and love with Buddhists. And there's a way in which I'm convinced the spirit of the faith tradition that we're in is one that has an all-encompassing dimension to it. There's universal language. It is the way in which the light, which is the truth, can be shared. And I think that one of the things we have to do is use the strengths that we have in the faith community in order to be a part of a unifying force. Because there's a lot of fragmentation, a lot of division, because of issues like those we mentioned here today. But yet, if you're going to move beyond the stigma, if you're going to move beyond the things that represent the stumbling blocks, the shame, and even the guilt, which people very often carry with this, there's a way in which those things can help us get beyond that. I actually believe, I tell people all the time, they say, you know, Ed, where does your passion come from? Why do you find yourself so committed to this? I figured out a long time ago that if we deal effectively with HIV and AIDS, we can deal with all the stuff that haunts us in our community and our world. Wow. You're not going to deal with HIV AIDS and not deal with education, because we know that almost 50% of the people that have the new infections are people that don't have a high school diploma. So it tells you education is a part of HIV AIDS, housing is a part of HIV AIDS, economic opportunity is a part of HIV AIDS, you know, and all the phobias and all the isms, you know, sexism, classism, racism, homophobia, all of those things that we deal with that fragment and divide and keep us from being the people that we have the infinite potential and possibility of being could be addressed as we collectively come together to respond to HIV. So I'd rather think that what some people have labeled as a curse is going to be a blessing.
That's wonderful. Well, thank you so much, Reverend. I've actually just been handed a few questions that we've gotten from some folks that are tuning in, and we're going to conclude with a little bit of a lightning round with some of these. Karen from Miami asks, how were you able to initially get into the church in order to spread the message of the disease? I think that was a question for Pernessa.
Well, I got into the church by saying, let's come together and pray. And prayer was a catalyst to come together and really do education. Because we always have to speak the language of the organization or the group or the targeted people that we are speaking to.
Absolutely. Phil, we'll give this one to you. Mary from Mississippi is asking, is there thought given to integrating this AIDS initiative as one part of the many medical services needed in rural areas? Any thoughts on that?
Well, I used to live in a rural area. I was the pastor of a church in a little town of about 800 people when I first went into the ministry. And in that town, I think more so than ever, in South Georgia and South Carolina, all of the southern small towns that I'm aware of, we need to educate still the medical professionals who are in that town. We need for the church to be a part of their journey, and we need to make sure that they hear the words that we need to speak, that the people living in your community are as infected and affected as the people who live in a city of 10 million.
Yeah. And I would just add to that. I was going to say that, you know, certainly the services that get left out sometimes are very important. Those supportive services like transportation, when there is no public transportation in rural areas for people with HIV and AIDS. And workforce is also key as well. We need to make sure that we have a steady stream of HIV specialists out there to continue to provide these critical services for individuals affected by the disease. Telemedicine is also another way that people with HIV and AIDS are receiving appropriate care in rural areas.
Tell us about telemedicine.
So telemedicine is one of the ways that it can focus on workforce issues and workforce development issues. And there's a lot of resources under the Affordable Care Act that can support telemedicine. And what it is basically, you know, a site is set up where, you know, maybe a second line provider like a nurse practitioner can, you know, look at a screen and see a provider in another part of the country performing something else. So it's very important when we talk about these rural areas and making sure that, you know, people are getting coverage.
And I think that you can connect the churches from the large cities to the rural churches, and helping them to see more wealthy churches to help them buy the transportation to get people. I see it working all the time in Atlanta.
Absolutely. Reverend Sanders, this next question is for you. Kevin from South Carolina asks, what action steps can a small cadre of non-denominational and denominational churches in rural South Carolina do to make a positive impact on HIV in that community? So it sounds like they've got some folks together already. What's a first step for them?
Well, I think one of the things is to take advantage of their collective commitment and make sure that it becomes a part of the awareness of everybody in the community. For instance, this business of testing publicly is one that has drawn the attention of media in a way that allows folks to want to see what is this and why are people doing it. Rural communities have a tremendous opportunity in that regard, because it does end up being the way in which you could probably reach people through, even in rural communities, the local media that's there. They will rush to see the fact that these clergy are standing and saying this is something that you don't have to be threatened by, you don't have to be fearful of. As a matter of fact, that's a part of dispelling the stigma and dealing with the myths, is to just remove some of the fear so that the levels of anxiety that people bring to being tested can be removed. Just in terms of that telemedicine point, one of the things that we're working on as a result of the President's initiative is through I serve on the work group that's dealing with public-private partnerships. What you find is that throughout the country, even in rural communities, there are certain franchise deliverers of basic medical care that, and medical supplies that are now developing within their businesses, clinics that are simple walk-in spaces that allow people in places that you would not think of. I'm trying my best not to call names. I guess we're not to make commercials for folks here today, but there are some of the network pharmacies and the like that have made commitments to adding HIV
Walk-in clinics, yeah.
to the list of things that they're addressing. That's tremendous because everybody has these stores that we've come to know as being the major presence of pharmacies all around the country. And as we get partnerships in that regard, not to mention the ways in which in rural communities it's important to be able to get the people who are a part of any collective, what they call elected processes, to figure out how to get it onto their agendas such that they realize that it's something that has to be addressed by them.
Outstanding.
So I think it's important to not dismiss. And also I should tell you, there is a rural AIDS initiative that's a collaboration between the University of Indiana, the University of Kentucky, and the University of Colorado, who are targeting the fact that, especially in the southeastern part of the United States, is where there's still a tremendous concentration of the disease, but it doesn't fit into the large city syndrome. It's not just Atlanta and Miami, it's all those places in between. And one of the things that a program from the Balm and Gilead that starts off with prayer all the way through a partnership with drugstores gives you an opportunity to make sure that that message is being carried into all those communities.
Outstanding. Well, friends, this has just been a dynamic conversation, and I've certainly learned a lot, and I hope you all have learned a lot too. I want to leave you with a bit of follow-up information so that you can take some of the information that you've learned today and move forward with it, and also so that you can share some of your stories and the tremendous work that faith-based organizations around the country are doing on these issues. Share those stories with us as well. I'm going to ask Chantel, if you don't mind, to once again just give us the website and the text information around testing, please.
First, I'll give you the information about the National HIV/AIDS Strategy, and you can go to www.aids.gov for that information. For the testing, I encourage you to go to first the CDC's website. It's cdc.gov. And you can also get more information about where to receive a confidential HIV test at hivtest.org. You can also text your zip code to KNOWIT, KNOWIT, or 56648.
Can't get any easier than that, so there's no excuses, right? And listen, if you're a faith-based organization that wants to engage with the White House Office of Faith-Based and Neighborhood Partnerships, our partnership center at HHS that sponsored this wonderful webcast, and if you want to get contact information, we've shared it a few times, but contact information for some of our panelists or engage in other ways, just shoot us an email. Our email address is whpartnerships. Again, that's whpartnerships with an S at who.eop.gov. Again, that's whpartnerships at who.eop.gov. We'll send you over to our friends at HHS or to some of the panelists that we have here and get you to the right place if you have other questions or things that you want to share. I want to thank our panelists. Let's give you all a round of applause.
Well, thank you. Thank you.
The tremendous stories that you've shared and for your passion and commitment to this critically important issue. I want to thank our friends at the HHS Partnership Center, Mara Vanderslice and Cameron French and Acacia Salati and Kimberly Conkle, Alexia Kelly, the Deputy Director of our White House Office of Faith-Based and Neighborhood Partnerships, Jeff Curley and Chantel Britton for their tremendous contributions and their great work in shepherding the President's HIV/AIDS strategy. And once again, a hearty thank you to all of you for the work that you're doing to address HIV/AIDS, to affirm the dignity of every single human being, and move forward to impact this critical issue. Thank you so much. Take care.